Welcome to the exercise library review. So before we start, let's talk about some things that this is and some things that this is not. You have a couple choices on where you want to use this. My advice is that this is used at the end. When I'm doing private tutoring, that's how we do it. We go through every chapter, you follow all of the steps, you learn what you're supposed to, and then this is just a way to kind of streamline everything into a study sheet for just the exercise libraries. Some people might prefer to use this after they do it section by section. If you have to, you can do that. I still think that you're kind of missing out on a lot of the proper learning. You don't want to reduce this to something that is like the equivalent of flashcards, because then if the question requires some interpretation, you're going to be at a deficit. So that's up to you. It's all going to be personal preference, but my strong recommendation is that this will be used at the end. What this is not a full review of the whole course. This is just for each of the exercises in each of the chapters. What are the most common test questions that are coming out of it? So we're not going to be covering things like definitions here. This is going to just be exercise related material. So there are two ways that I have presented it, and they're both here together. So part one, I'll show you it as we're going to scroll through. We're working off the PDF that is going to be yours. There's no reason for us to do this in a PowerPoint because you kind of want to see it in the format you're going to be studying it from. Then what we have second is something that is more detailed notes on each of the exercises, where it's just the information that most frequently produces test questions that I'm aware of. It doesn't mean that you might never see anything outside of it. If it is a really common question, then it's going to be highlighted. So we'll go through all of that. But remember, this is not ever to be done in place of watching the videos, watching our lectures, and then looking at our notes at the same time, because you want to learn these exercises. In the ideal world, you'll also be doing the exercises, but it's really important that you're going to study them so that you can see and hear what are they saying on the NASM account. What are they saying when I watch this exercise video? What are the tips, the form, technique, progressions, regressions, all of those things you want to watch there. And it doesn't make sense for us to have all of those videos because they've done a fine job with those already. You have access to them. This is going to be complementary to that. That is going to be learning the stuff, but this is going to mostly, this document, unlike everything we've done prior, is just about the test. All right, so let's dive in, and we're going to kind of come through it at a pretty good pace. So if you need to slow down, stop, go back to your notes from this area if you feel like it's a weak one, or just even make a little note for yourself. Listen back to this recording, review these notes. However you feel is going to be the most effective for you to make sure that this is the stuff that you have on lock before you take this test. Okay, so in the assessments, we first start with the physiological, how the body functions. The two big things are going to be heart rate and blood pressure. So remember, your resting pulse, anywhere from 60 to 90 is acceptable. The best time to take the resting pulse is when you're truly at rest in the morning on waking. Take it 3 days in a row and get an average so that we can get a better feel, like we're not going to just rely on one number. For the blood pressure, our top number is the systolic. That's our maximum pressure. That is when the heart contracts. The pressure in the blood vessels when they squeeze to propel that blood into the body. The diastolic is when the heart is resting. It is filling with blood, getting ready for the next contraction. So that's our minimum pressure. So a healthy blood pressure is 120 for the systolic, over 80 for the diastolic. High blood pressure is anything above that, but what is high enough that you're going to be required to take medication is when the systolic goes 140 or higher, or the diastolic goes 90 or higher. Body composition. So these are the things that we're going to use to measure body fat, or in some other way to assess the composition of the body. So some of it will not be body fat percentage, lean body fat, and lean mass, none of that. But they're all going to be looking at how the body size, shape, these kinds of things. So we start with the skin fold calipers where we grip the fat. You want to make sure you repeat it. So 2, maybe 3 times per site. This will calculate body fat. If we use the Derman-Womersley formula, we want to memorize the 4 sites: biceps, triceps, suprailiac, subscapular, below the shoulder blade. So the folds themselves, biceps, triceps are vertical, iliac and subscapular are going to be diagonal, 45-degree angles. We could do the circumference measurements. That won't tell us body fat percentage, but those are great. No, review the sites, review how to position the tape measure. And one of the questions that comes out of that a lot is that it's a good method for obese clients. Waist to hip ratio, very strong connection to risk of chronic disease. For women, we want it to be under 0.8, for men under 0.95. Remember that these are percentages. So we want to move the decimal and think of it as a percent. A woman's waist should be 80% or less than her hips. A man's waist should be 95% or less of his hips. If it's higher than that, the risk of disease increases very quickly. So BMI, this is the one we want to be ready for. Not exactly trick questions, but they want to make sure that you know that BMI does not tell you body fat percentage. So the units, it's metric. We're looking at our weight relative to our height. So the measurement is kilogram per meters squared. Make sure you get that squared in there. The 3 BMI ranges that we're mostly concerned with: normal, 18 to 25. Overweight is going to be the next group up, 25 to 30. Obesity is defined as a BMI over 30. And then you have the scales of obesity. You also have underweight, but those are the big ones we want to know for the test. Remember that the risk of obesity-related diseases starts when you're overweight. Okay, so it's not like there's no risk of being overweight. Okay, for the cardio tests, we'll start with the YMCA 3-minute step test. So this is the one that they might describe as that sub-maximal, because you're not going all out, bout of stair climbing, where you set up a stepper and they're going to be stepping up and down to the beat for 3 minutes. 12 inches off the ground, 96 beats per minute, and then you immediately take their recovery pulse. So this is where you're going to sit them down. They don't talk. You take the pulse for the full 60 seconds because you need to see how hard their heart is working at the beginning and how it recovers throughout that minute. The other kind of pulse that we take is the post-exercise pulse. And it doesn't mean at the end of exercise, it just means after any exercise has been done. So say that we get working and we want to see how hard is the heart working right now. We're not worried about recovery. We could just take a 6-second pulse, multiply by 10. That will tell us how many beats are happening in a minute in the 60 seconds, or a 10-second pulse and multiply by 6. Again, that will tell us how many beats, estimate how many beats are happening in 60 seconds. Okay. Rockport walk test. This is going to be the one where they walk a mile as fast as they can. And remember that what we put into that formula are gender, age, and weight. You'll probably only see that with one. So memorize all 3. And sometimes you see that what this one is calculating is your VO2 max, right? The maximal oxygen consumption, that if you were working 100%, how much oxygen could you bring in one gulp? So that we see that sometimes, and that's different than the heart rate ones. RPE, know both scales, 1 to 10 and the Borg scale. VT1 and VT2 tests, review the techniques for those. So remember, those are going to be using the talk test to get to VT1, where you hit that threshold when they are at an intensity level that their breathing starts to become a little labored. And then we work all the way up to VT2. VT2 is that threshold at which they can no longer talk at all. So like beyond that is going to be sprinting. VT1, equal use of carbs and fat to fuel the activity. Okay, static posture is going to be where they're not moving. So that's where you would be looking at things like, are the shoulders level? Are the hips level? You could look back to the picture from assessments 4, section 4 for that. Dynamic posture, these are going to be the big ones. This is when we're in motion. So we have the overhead squat assessment, the single leg squat assessment, pushing assessment, pulling assessment. Overhead squat from the front, start at the ground up. We want to see what is happening at each of the checkpoints. Feet, ankles, knees. Are the feet turned out? Compensation. Are the knees caved in? Compensation. Then we come to the side view. We're going to ask them to do more squats. And then we're going to be looking at what's happening in the shoulders and the low back. So in the low back, is it arching excessively? What is their alignment like? Is there the excessive forward lean? Are the arms falling forward? So come back to what we want as good squat form in this and all squats. Toes pointed forward, knees dropping in line with the second and third toes. The low back could have that minimal natural arch to it. A good alignment where if you lean back, if you sit back into your glutes, that you're going to create that straight line, shoulders, knees, toes, and that the arms can stay up overhead because the lats are able to lengthen to allow for shoulder flexion. Single leg squat is going to be all the same things, except it's going to also be looking at ankle proprioception, because when you're on one side, you can see, are they trying to balance through their core, or do they have to balance through their ankle because the core is too weak? Push and pull, you're going to look at these from the side view, and you mostly want to see here about shoulders elevating, head comes forward. The low back, you can see the arch too, but that's not new information because that for us funnels back to low back arching during an overhead squat. So for all of those, we must have the overactive, underactive list memorized, know what it means if they word it different ways. Overactive, shortened, right? Like this, tight, underactive, lengthened, needs to be strengthened, overactive needs to be stretched. However they ask it, we need to know every one of those muscles. And so all the compensations we just talked about, each of the checkpoints, but then know the 3 postural distortion patterns too. The pronation distortion, lower crossed, upper crossed, and how those connect into these in case you get an overactive, underactive question from those where you don't need to memorize everything. All right, performance. We have the push-up test to start, upper body muscular endurance. If we did a bench press test, this is going to be upper body strength. So that is going to be called the upper extremity strength assessment, versus squat is going to be lower body strength, lower extremity strength assessment. Know the protocol step by step, in and out, inside and out, for the bench press and the squat. And this is the same technique that you'll follow for any 1 rep max testing, where it's going to be sub maximal. We're going to go to 3 reps. Okay, so everybody they warm up, right? Get a warm up set, 8 to 10 reps, lightweight. They don't need a lot of rest, just a minute. And then we go 3 to 5 reps. They must do with clean form. As long as they do, then they can rest 2 minutes, during which time we're going to increase the weight according to like the body part, and then repeat 3 to 5 reps, rest 2 minutes, increase the weight, 3 to 5 reps, rest 2 minutes, increase the weight, until we hit the weight at which they will fail. And when that happens, then we go back down to the last weight that they completed with good form, and we take that number to a 1 rep max calculator, where it will say to us how much weight was lifted and how many reps did you do, and then it estimates it out. All of our strength calculations are going to come from that. So this isn't like something that we're doing for fun. We're doing this to be able to program the resistance training. Okay, the thing that is different is upper body, lower body numbers. For the bench press, every time we have a new trial, we add 10 to 20 pounds on. For the squat, we add 30 to 40 pounds. Remember, lower body is stronger than upper body, so we can add more weight to it. If they ask it in pounds, 10 to 20 pounds, 30 to 40 pounds. If they ask it in percents, it's a smaller percent increase for the upper body, 5 to 10%. A bigger increase for the lower body, 10 to 20%. We do not want to confuse 10 to 20 pounds increase for the bench press with a 10 to 20% increase for the squat. Okay, so just think of them in lines: 10 to 20 pounds, 30 to 20, 10 to 20 pounds, 30 to 40 pounds, 5 to 10%, 10 to 20%. And then you can just kind of figure out in that grid which one they have asked you. Okay, so for the performance assessments, then at the end we have vertical jump. is going to be like explosive power of the legs, right, vertically. Long jump is going to be explosive power horizontally. The LEFT test, the left test, lower extremity functional test, that's the one where we have all the agility, all of the change of directions. The 40-yard dash will be pure linear speed. And the pro shuttle test, the pro agility test, also called the 5-10-5, where they start in the middle, sprint 5, sprint back 10, sprint 5 to the middle. That will be speed and agility, because we're going to have to change direction and decelerate too. Okay, so once we come to the flexibility chapter,